DW Africa Link.
As soon as WHO was aware of the signal, support was provided to DRC to investigate as quickly as possible. Investigations are ongoing to ascertain when and where exactly this outbreak started. Given the scale, we are thinking that it has started probably a couple of months ago.
Ebola has resurfaced in the Democratic Republic of Congo just 5 months after the Ministry of Health declared the end of the previous outbreak. This is the 17th recorded Ebola outbreak in the DRC since the virus's discovery in 1976. Meanwhile, Uganda has confirmed 3 cases of the Bundibugyo strain, a relatively new variant compared to earlier infections. In today's episode, we'll explore what makes the strain different, the risk it presents, how it spreads, particularly across borders, and the strategies for rapid containment. Stay with us. This is Africa Link, the podcast that connects you to the stories that matter across Africa. I am Adwoa Tenkorama Domena, your host for today.
Africa Link, every weekday here on DW.
Welcome to the show. Our focus today is on Ebola, a disease that triggers immediate global concern due to its extremely high fatality rate. On Wednesday, May 20, the World Health Organization reported 600 suspected Ebola cases, including 139 suspected deaths, cautioning that these figures are likely to rise because of the time the virus circulated before detection in Congo and in Uganda. However, the world has faced Ebola before, and some countries have achieved notable success in controlling outbreaks. For example, Liberia managed to contain the virus effectively during the West African outbreak. Today, we speak with Dr. Gabriel Gorbee Logan, who was on the front lines of Liberia's response during the 2014 to 2016 outbreak. We're also joined by South African virologist Dr. Jinal Bhiman. She will explain the virus's mutation process, how it differs from other strains, and the best ways to respond. Welcome, both of you. Dr. Logan, you served on the front lines of Liberia's response to the 2014 to 2016 Ebola pandemic in West Africa. What was your initial reaction when you learned that Ebola had returned to the DRC only 5 months after the previous outbreak was declared over?
Well, thank you so much. Just from hearing that, in fact, the social media spread that very fast, and our people started having concern, what is happening in the DR Congo. And for us here in Liberia, all we started to do is to make sure that we send an advisory to all of our people, our citizens across the country and people within our border that, we wanted to know that there is no Ebola in Liberia, but the Ebola situation in the DR Congo, we are closely monitoring. And at the same time, as a country, we have stimulated our surveillance system, and everyone is just preparing for just in case. So those are the things that started running through my mind, that having gone through a lot in 2014, 2015, even up to 2016, as a country, we were highly hit during those days. But we also learned some lessons. A lot of capacity were built. So even on the ground now, there are a whole lot of skills on the ground, to go around this. But hearing such a news, no one will be happy when they hear about Ebola. Usually there will be some kind of chills running in the spine of everyone.
Definitely. Doc, and I'm going to come back to you later about the strategies that help Liberia combat Ebola then, and what, are the best practices or what the whole world, can adopt now. But let me go to Dr. Jinal at the moment. Doc, you are a virologist. the WHO makes us understand that this is the Bundibugyo strain of the virus. Is this different from the strains that we have known in times past?
Yes, that's correct. So there are a number of different Ebola virus species. And so, for example, the Ebola virus species that caused the 2014 outbreak is in fact different. And what this means is that the vaccines, the therapeutics that were developed for Ebola virus Zaire will not be effective against the Bundibugyo species. And so they are, even though they have this, they're in the same viral family, they are quite different from each other. And that's also part of the reason why the WHO has declared this an extraordinary event.
What does it mean to describe this as an extraordinary event? We have heard the WHO, for instance, say that the cases may be spreading faster than they originally thought. What does it mean? Should we be worried?
So yeah, it means that the outbreak is well underway. Before, of course, we had been aware of it. It also means that, unfortunately, infection control measures were not in place. And so, for example, some of the deaths that have been suspected have occurred in healthcare workers. And it's an extraordinary event also because unfortunately, we don't have measures in place to assist with treatment and prevention. So we don't have a vaccine, right? We don't have therapeutics for this particular Ebola virus species, and that's why it's quite a significant event. The outbreak is well underway. We don't have the measures that we need to halt infections in terms of having therapeutics or in terms of having vaccines. Our only measures now for getting this outbreak under control is really isolation, limiting, congregations of people, those kind of physical interventions.
Interesting. Dr. Logan, what can you say about immediate things that perhaps health authorities in the DRC may have missed or should have done that they haven't been able to do?
Yeah, thank you so much. The first thing is that most of the testing capacity that have been, even not only the DRC, but even in other countries, have been programmed towards detecting the Zaire strain. But now because the last time we had the Bundibugyo was in 2007, all right? And from that time, we haven't had repeated cases that were involving that strain as compared to that of the Zaire strain, which have been coming more often. So most of the system, they prepared towards detecting the Zaire strain. Now that we have the Bundibugyo strain and knowing that in that region, a lot of the laboratory are not even testing for that. So that is enough to have a case going from person to person and undetected for a period of time before even people get to know. So it is possible that the virus can spread very fast in that region and even go to other countries.
Has anything changed as far as the spread of Ebola is concerned? What is widely known to be how it spreads from person to person? So, for instance, an uninfected person coming into direct contact with an infected person and they'll get, the disease. Has anything changed, Dr. Jinal?
It doesn't appear to seem like the mode of transmission has changed at all. It is highly contagious. And, the biggest issue is that coming into contact with an infected person, whether you are caring for them, for example, as a healthcare provider, or whether you are somebody who shares the same household, that is the type of close contact that really facilitates the transmission of this virus and this virus family. But we also know, there are certain funeral practices, for example, which also kind of help this virus transmit. So even after the person has passed away, there is still the potential for that person to transmit the virus to uninfected people. And so right now, at this point, for example, unless very strict infection control measures are in place, deceased individuals are not, their bodies are not allowed to be transported across countries' borders. And that is the reason, because even when somebody has passed on, they could still transmit the virus. At this point, I think we're still waiting for sequencing of the virus to see whether there are any changes that we should be concerned about. But based on everything we know so far, it doesn't look like the mode of transmission has changed. But that's not comforting, because it is a very, very infectious virus. It's very transmissible. And so, even though there hasn't been changes, it's still something that people need to be very aware of and very cautious of, especially in the DRC and Uganda right now.
Would you describe West Africa's fight against Ebola as successful at the time it happened? And why do you think it was successful?
I would say yes, because on the initial stages, it was a new disease to us in West Africa at the time. So messaging were not going, in one direction initially, but then later on, that piece was corrected and messaging started to go directly from the Ministry of Health to the population. So we're able to overcome that. Also, we had situation where, like for example, people in the early stages said, oh, if you have Ebola, you will die. Later, we said, no, if you have Ebola and come early, you have an opportunity to get treated and you can survive. So we have to change the narrative. And then the other piece has to do with getting the community involved in the epidemic. Initially, remember my colleague was telling you about the funeral practices and other means by which the virus can spread very fast. So without involvement of the community, you are not going to succeed, because there are people who are trusted in those communities, ranging from chiefs, religious leaders, traditional leaders, and they do all kinds of rituals. So if you don't have the people, you don't engage them properly, you will not be able to get the message to them, and they will not be able to help you to identify cases. So it was like initially we had some difficult time, but along the way we were able to overcome the situation. We learned a lot of lessons, and in the end we succeeded. So that's how it went. But from the beginning, there were some difficult times we had.
Asking this because yes, this strain is quite different, and they're still, trying to do the sequencing of the genome and all of that. But there are some best practices that, have worked in times past. So what are these best practices that, number one, the DRC, Uganda, and any other country that may be next in terms of transmission can adopt quickly to contain, the Ebola spread?
So I will outline a couple of things that can be done currently. Like for example, we need rapid case detection and isolation. So like I told you earlier, the sooner you test people, you get to know the problem, you isolate them, and then that way you can be able to address problems surrounding them. The other one has to do with aggressive contact tracing and ring containment. So contact tracing meaning you have to put people out in a few, to go and look for the cases, find the cases. And the good thing I like about Ebola though, is that if someone really has Ebola, one of the key things you're going to notice is this extreme weakness that is associated. They will always tell you that this person cannot move. In fact, most times they will be supported by either a relative or a friend. And that's one of the things that even help to spread the virus. So the sooner the contact tracing team can find people in the community, and then even those who are known cases plus their contact, to even isolate them as well, is going to help. Another one has to do with this general stop about infection prevention and control at the healthcare facility. Of course, both the client as well as the healthcare workers have to observe these strict RPC measures, to be able to avoid spread. The other piece has to do with safe and dignified burial. You remember, along those lines, there are cultural sensitive, issues. So the barrier thing have to take into consideration about that, allowing, religious leaders, traditional leaders to get involved with this, even if they are to stay from the distance, because it's going to help you. And also telling them not to directly, touch these people with their bare hands, because it could serve as a means to spew the epidemic.
I want to bring in Dr. Jinal, just because while you were talking about contact tracing, about isolation and all of that, my mind took me back to COVID times. Dr. Jinal, we've had COVID-19. Has it presented us with best practices in terms of how we deal with some of these disease outbreaks?
Yeah, I think, the big thing is from our days with the COVID-19 pandemic is isolation and staying away from large gatherings. All those kind of things that we did for COVID, those are the kinds of things that are going to assist here. There are obviously differences, but I mean, even during COVID, funerals, for example, in South Africa, were very quick events, very fast. In the very early days, they had to be sealed caskets, for example, and everyone is distanced, from the person that has passed away. So those practices are still the things that are going to be useful here. Some of the differences, though, are, kind of things like masks, for example, might not be that useful in stopping the transmission, except, for example, if you are a healthcare provider or you are somebody who's living, with an infected person. But physical contact is really the thing that is the mode of transmission with Ebola. You do need that physical touch of the person that is infected and of their bodily fluids, for example. Whereas with COVID, I think it was a bit more difficult, to stop that spread. The difference, though, as well, is that with Ebola, the death rate is much higher. It's much, much higher than with COVID. And in a way, that also, as Dr. Logan was saying, that helps, to be able to identify cases quicker. And so in that way, it does help us to be able to put in these infection protection control measures in place. With COVID, there were many people that didn't have symptoms at all. And so that is how the virus was transmitting much, much quicker. That's, for example, why other countries, more distant from DRC, we've got a low risk of this, coming to our countries. For example, South Africa, our National Public Health Institute, our government have said, it's a very low risk for us because, the mode of transmission has a few more barriers to it. But regardless, I think a lot of the practices that we did have in place during the pandemic should be followed.
Right. I have one last question for the both of you. But before that, Dr. Gabriel, talk to me about the border-to-border transmission and what the fear is. The WHO, for instance, has warned that countries that are close to the DRC, should take particular attention. What can you say about the border-to-border transmission and what can these countries do at the moment?
Well, it is not only those countries around the DRC. It is all of the countries in Africa, even beyond. I say this because, people are traveling by air transport, and someone can have Ebola in the early stages and board a flight. So that's how serious this thing is. For me, in that region, like I was explaining, lot of economic activity that go on other side of the border, both on the Ugandan side and on the DR side. And because of that, there's mass movement of people, a whole lot of gathering going on. Don't forget, in that northern region, a lot of mining activity also going on in those regions. They have a whole lot of transportation hub that sort of bring people together. So part of the public health education is to tell people that, they should be aware of this thing. And even I would suggest they open triage stations. They take triage station very close to the people, either from hospital side, from the mining, transportation hub, on other side of the border, checking, even in displaced camp, all of that should be taken into consideration. But the current outbreak in the DRC, it has a higher risk of learning in any country, and not only neighboring.
Right. We know this Ebola is coming at a wrong time and wrong in, holds, because the US has cut aid to a lot of its, partners. The USAID essentially has been dismantled or discontinued. And we know the critical role the USAID played during the last time we had an outbreak like this. What immediately are the concerns among public health experts like yourself in terms of how best we can fight this Ebola without major funding support?
Well, to be very frank with you, the risk is that those countries will have to now fill the gap through their national budget, because a failure to address that piece, that means that gap will remain there. And it is, whenever we have epidemic of such, it often affects normal service delivery. And in affecting normal service delivery, meaning that people are going to have they are going to have problems and even death due to other conditions alongside the epidemic as well, which could further compound the situation. So my approach would is to ask governments that are caught up with this USAID supported situation.
Thank you, Dr. Logan. But now let me go to you, Dr. Jinal. We know that the world, is also dealing with hantavirus at the moment. How prepared do you think Africa is to contain all these, overlapping health threats?
The Ebola outbreak is completely different. It's much bigger. We don't have a handle, as Dr. Logan said previously, on who the cases are. We don't have a handle on who their contacts are. And I think, in as much as we learned many lessons from the COVID-19 pandemic, there are still very many gaps that we as Africans need to address in terms of our outbreak response control, and also in terms of epidemic and pandemic preparedness.
Very well. Thank you so much, Dr. Gabriel Gorbee Logan. He is a public health specialist. He was also at the front lines of Liberia's fight against Ebola between 2014 and 2016. Dr. Jinal Bhiman, she is a virologist. Gentleman and lady, thank you so much for your time. I'm grateful.
Thank you, Adwoa.
According to the WHO, the Bundibugyo strain is spreading rapidly. The organization has declared the outbreak a public health emergency of international concern, though it has not yet reached pandemic levels. Countries, especially those bordering the DRC, have been urged to implement precautions to prevent further spread. With a fatality rate of roughly 40%, health experts warn that inadequate safety measures could lead to another major health crisis, just as the world is recovering from COVID-19. To those of you traveling globally or within and around the DRC, please stay safe and take necessary precautions to protect yourselves from Ebola. If you've already been exposed or infected, kindly follow the guidance of health professionals and take steps to protect both yourself and those around you. And that wraps up today's discussion. You can share your thoughts on Facebook and TikTok at DW Africa. Listen to us on Spotify or wherever you get your podcast, and subscribe to the DW Africa YouTube channel. This show was co-produced and edited by Isaac Mugabe, and I am Adwoa Tenkorama Domena. Bye for now.
DW, made for minds.